POTS disease. Well, pot could be you can planting your pot, your soil. It could be marijuana. It could be all sorts of changes in heart rate. We're going to learn about POTS. What is POTS? So first of all, we really thank all the firefighters out there. These are young people who risk a lot to help us. And I always think of a burning inferno inside of us, sometimes with rage and anger for something, but also your burning fire from blocked arteries. So a special thanks to my son Josh, who's out there up north right now fighting fires, and they're extremely well trained and well fit young individuals. And to all the victims there, our sorrows, and for those who sacrificed, thank you so much. Um, so right now is that if you want to go directly to the Red Cross, you can donate. And there's, as you mentioned, there's a tripling phenomenon. We decided to give just now just $5,000, and that basically anybody who buys a book, all the money goes to that. So the book for $30 becomes $90 to helping others. And the whole purpose of this book, 30 Days to Healthier You, is to help others. And so I hope people actually read the book, look at the book, and read that book 10 times. So is it 10 times 30 or 130 Days to Healthier You? It's basically 30 days done over and over again. And so to all the victims, deep sorrow, and to all the people fighting fires, thank you so much. You're our heroes. Tell us more about POTS disease now. Is that a cause of POTS? Is forest fires a cause of POTS disease? It makes my heart rate go up. Um,
Could be. Thank you, Dr. Curnew. Yeah, so let's start off with talking about what POTS is exactly. Well, POTS stands for Postural Orthostatic Tachycardia Syndrome, or tachycardia syndrome, sorry. And POTS is a condition that causes your heart to beat faster, usually when a person goes from lying down or sitting to standing up. If a person has POTS, it means that their body has a harder time keeping their blood pressure steady and stable in various positions. So normally when someone stands up, gravity causes blood to gather to the lower half of the body. The body reacts by sending a signal by way of hormones to moderately increase heart rate so that blood can go to the heart and brain in the upper body. For people with POTS, the body does not react in the same way to the hormones, causing not enough blood to reach to the brain, leading to brain fog or dizziness. The body continues to release the hormones, hoping for a change, which can cause an even greater increase in heart rate, leading to chest pain, for example. So overall, POTS is caused by lower quantity of blood circulating in the body, excess gathering of blood below the heart when standing upright, and elevated levels of certain hormones. So one of the ways to test if someone has POTS is by the table tilt test. However, it's difficult to get the results back in a timely manner, but it is one of the ways that you can test for it. So in this process, an individual is secured on the table while lying down. The table is raised almost to an upright position, and then the individual's heart rate and blood pressure is documented during the duration of the test to see if there is an increase in either point.
So what we can do is that you can do your own test at home. So getting a tilt table test in Hamilton, the waiting process is well over a year to 2 years. Again, this is called postural orthostatic tachycardic syndrome. As it says, as you go from sitting. So what I would do is start sitting down, measuring your blood pressure and heart rate a number of times in a relaxed position. Then you stand up, and you stand up for up to 10 minutes. And you should see normally is that as we stand up, depending on circumstances, your blood pressure and heart rate will adapt to that. For most people, it will be a small change in blood pressure, usually less than 10 millimeters difference in blood pressure, and heart rate less than 10 millimeters of mercury. And actually, as we get older, our reflexes don't work as well. I know, for instance, when I was a young kid, I loved going on the rides at the amusement park. Now I get sick going on the rides as I spin around and move, because my blood pressure is not as well stabilized as I was as a young lad. Uh, Also, too, is that we often use medications to lower blood pressure. So part of the problem is that we know if we start people on blood pressure medications, we have to be attentive that we don't lower it too quickly, too fast. But basically, POTS is defined as a change in heart rate of an increase up to about 30 beats per minute. And most of the time, the blood pressure won't change that rapidly, that much. And the person will feel lightheaded or dizziness. So you can do it on yourself. And I think a really good example to do if you're feeling dizzy anyways is to measure your blood pressure, sit down, rest, and measure your blood pressure. Now, the only thing different about this is that when I measure blood pressure, I put my hand on the table. So you have to sit next to a table because you want your arm at heart level when you measure blood pressure. You notice that the blood pressure machine is at heart level and the arm's at heart level. So the table that you're sitting at has to be at heart level, and you have to be relaxed. And then we should do that on a regular basis, and many of us. And POTS, as you mentioned, is just an over-exaggeration. You have trouble maintaining blood pressure and heart rate. Again, 30 beat rise within 10 minutes of going from supine to standing position, or in this case here, from sitting to standing is the cheaper way of doing that. Tell us more.
All right, so some of the general symptoms include dizziness or lightheadedness, fainting or near fainting, as well as brain fog, as I mentioned, fatigue, headaches, chest pain. So as you can imagine, these symptoms are quite general and they can lend themselves to other outcomes. So again, it's best to speak with your doctor to deduce if you specifically have POTS. So in terms of treatment options, one of the main treatment options include regulating one's diet and maintaining a consistent low-strain physical activity routine. So specifically a diet that includes drinking lots of fluids frequently and salt and having salt-based foods has shown to increase water in the bloodstream, which can help more blood reach the heart and brain. And then, of course, some medication may be advised, such as beta blockers, which can help with reducing heart rate. So in terms of triggers, there are a plethora of different triggers, and more so there's a lot more to learn about POTS, and a lot of the ongoing research has deduced some of the causes of POTS, but we know overall it's multifactorial. So what we do know is that POTS mainly affects women between the ages of 15 and 50, and it's been noted that symptoms often worsen for women just before their periods. Symptoms have also been noted to begin during pregnancy or following a major surgery, trauma, or viral illness, suggesting that there are many, not just one cause, and multiple factors may play a role in the development of POTS. So in terms of some factors that may trigger or worsen symptoms, this can include being in the heat for too long, dehydration, alcoholic consumption, intense exercise, as well as being or just starting one's period. So the main question is, why is it that women experience POTS more? So again, both men and women can experience POTS. However, according to Shaw and colleagues, almost 95% of patients diagnosed with POTS were women. So one reason that has been proposed is that the female nervous system adjusts more slowly when needing to get up. Another reason deals with more of the anatomical differences. For example, women have on average less blood volume, even when corrected for size, causing the body to have to work harder to transport the blood to the upper body. Women also tend to have stiffer hearts than men, which can impact how well they can push blood to the rest of the body. Women are also known to have over flexible connective tissue, which again makes it harder to push fluids upwards. Overall, go to the next slide. All right, so both men and women can experience POTS, as I mentioned, but more women deal with POTS than men do. And colleagues in terms of research have figured out that 95% of patients diagnosed with POTS were women. So again, one of the reasons that were proposed is that the female nervous system adjusts more slowly when needing to get up. Another reason, again, is the anatomical difference. So for example, women have on average less blood volume, even when corrected with size, causing the body to have to work harder to transport blood to the upper body. Women also tend to have stiffer hearts than men, which can impact how well they can push blood out to the rest of the body. And then again, women are also known to have flexible connective tissue, which makes it harder to push fluids upwards. So other reasons why it's more common for women to have POTS deals with hormonal factors. So hormonal fluctuations play a significant role. During puberty, menstruation, and pregnancy, women experience shifts in hormone levels, particularly estrogen and progesterone. These changes can impact blood vessel function and heart rate regulation, making women more susceptible to POTS. We also have the topic of autoimmune association. So women are also more prone to autoimmune conditions, which have been linked to POTS. Studies show that around 80% of autoimmune disease cases occur in women, and these conditions can affect the part of the nervous system that triggers POTS. We also have the idea of genetic predisposition and how genetics may play a factor. Research suggests that certain genetic predisposition might make women more likely to develop POTS, contributing to the higher incidence in females. For example, some studies have found that a familiar pattern in POTS indicate a potential hereditary component. So diagnosing POTS in women can be challenging due to several factors. So the one component is symptom overlap. So research shows that POTS symptoms overlap significantly with other conditions. For example, up to 50% of POTS patients are initially misdiagnosed with anxiety disorder. This overlap complicates accurate diagnosis and can lead to delays in proper treatment. We also have the idea of symptom variability. So POTS symptoms can vary greatly from person to person and even fluctuate within the same individual. A study found that 75% of POTS patients experience variability in symptoms, making it really difficult for clinicians to recognize the condition, especially in the absence of a standardized diagnostic protocol. Then, of course, we have the idea of gender bias. So gender bias in healthcare further complicates diagnosis. Studies have shown that women's symptoms are more likely to be attributed to psychological causes, leading to misdiagnosis or an underdiagnosis. So, for example, one study found that women presenting with cardiovascular symptoms were less likely to be referred for appropriate diagnostic testing compared to men, which can again contribute to delays in diagnosing conditions like POTS. So to better address these challenges, it's important to consider adjusting the diagnostic criteria for POTS, particularly for women, by recognizing the unique aspects of how the condition manifests in them. So when it comes to the heart rate increase, the current diagnostic criteria includes observing a heart rate increase of 30 or more beats per minute within 10 minutes of standing, which is a key marker of POTS. However, due to the nature of orthostatic intolerance, where standing itself becomes difficult, the criteria should be closely monitored in women, as hormonal fluctuations can exacerbate this response. Adjusting the heart rate threshold or the time frame for measurement can provide a more accurate reflection of the condition in women. We also have the case of symptom clusters. So given the variability and overlap of symptoms, a more nuanced approach might include identifying specific clusters of symptoms that are more prevalent in women. For instance, incorporating assessments for symptoms like chronic fatigue, brain fog, or gastrointestinal issues, which are frequently reported by women with POTS, could lead to a more holistic and accurate diagnosis. We also would imply having consideration of hormonal cycles. So since hormonal changes can significantly affect POTS symptoms, integrating an assessment of symptom variation across different phases of the menstrual cycle could provide better insight. Women might need to be evaluated at different points in their cycle to capture a more accurate picture of how POTS is affecting them. We also have the idea of comprehensive autoimmune screening. So again, given the strong association between autoimmune conditions and POTS in women, including routine autoimmune screenings as part of the diagnostic process, could help identify underlying causes. This would allow for a more targeted treatment approach and reduce the risk of misdiagnosis.
You can see that the differential diagnosis is very, very, very wide and broad, and it could include other disease processes. And one of the things is that you could have more than one disease process going on at once. So, for instance, if you're iron deficient or you're anemic, that's something you need to look at, because being anemic can make you tachycardia. Just being iron deficient with normal hemoglobin can cause this problem. If your thyroid is overactive, it can speed up your heart rate. So let's just list something in the differential diagnosis is that you can have inflammatory disease. Alcohol makes everything worse. You can also have your autonomic system, the reflexes, your parasympathetic and sympathetic nerve conduction and firing could be abnormal as well. Diabetes can cause this as well. And now part of the equation is COVID-19 has been associated with POTS syndrome too as well. And, part of long COVID could be one component could be POTS as well. So this is not an exhaustive feature, but there's all sorts of reasons why your blood pressure and heart rate can change. And I just list some of these things. So next slide, please.
Thank you, Dr. Curnew. So as I mentioned before, there are a few ways that someone can manage their POTS. So one of those include a lifestyle change, which includes, again, increasing salt and fluid increase, regular exercise, and even wearing compression garments. So to give a little bit more detail, patients are often advised to increase salt and fluid intake to help expand blood volume and improve circulation. And this can reduce the severity of symptoms such as dizziness and fainting. We also have the idea of regular exercise. So particularly aerobic and resistance training can help improve cardiovascular function and build tolerance to orthostatic stress. Starting slowly and then gradually increasing intensity is crucial, as overexertion can worsen symptoms. Also, wearing compression stockings can help prevent blood from pooling in the lower extremities, which again is something we mentioned as a common issue for POTS patients. This can reduce symptoms like lightheadedness and improve blood flow back to the heart. And of course, we have some medications. So one of those include beta blockers, as I mentioned previously. These medications help to manage heart rate and reduce symptoms by slowing down the heart's response to orthostatic stress. We have fludrocortisone, which this medication can help retain salt in the body, thereby increasing blood volume and improving symptoms related to low blood pressure. We also have mitocrine, which is a medication that helps narrow blood vessels, which can prevent blood from pooling in the legs and improve blood flow to the brain when standing.
It's kind of interesting if you go back one slide again. Some of the exercises is that sometimes, you have to do your exercises more in the recumbent position. So some people will have some sort of exercise bikes that are sort of, or closer to the ground, or and so just trying to do exercises lying down some sort of adaptive way in the circumstance. And so it reminds me is that there's different ways of exercising. Just getting up and running on a treadmill, if you feel lousy, standing up is probably not okay. So learning to do exercise or swimming, for instance, may be a better form of exercise for you. And that's why just measuring your blood pressure and your heart rate and response is such a key factor. Looking at the reasons why certain medication, if you have high blood pressure, then we need to think about, are we really going to treat your blood pressure very vigorously? Because we don't want to lower your blood pressure and make you feel more dizzy. As I get older, I'm getting more dizzy. So I don't have POTS disease. I just have basically my autonomic system doesn't work as well as being a young person. And one of the things that you mentioned really important is resistance training and just training yourself. So I'm trying to build more muscle so I can have those arteries that respond better to stimuli. So thank you for sharing that. Next slide, please. Tell us more.
Yeah, thank you, Dr. Curnew. So we just wanted to end off with touching on ways to support patients further than just medication and diet and exercise. So a part of that includes patient education. So educating patients to recognize and avoid common triggers such as prolonged standing, heat exposure, and dehydration, which are all keys to managing POTS effectively. We also wanted to mention stress management, as stress can exacerbate these symptoms. So teaching patients stress reduction techniques like deep breathing, meditation, or yoga is essential. And this can help improve overall quality of life. And of course, the concept of gradual changes in posture. So patients should be advised to make slow and deliberate changes in posture, such as rising slowly from a seated or lying position to, again, minimize symptoms. And of course, it's important to mention some follow-up care. So in terms of regular monitoring, having ongoing monitoring of symptoms is crucial for managing POTS. Regular checkups allow healthcare providers to track the effectiveness of the treatment plan and make any sort of adjustments. And going off of that, just having a treatment plan that, again, should be flexible and can be adjusted based on the symptoms and the overall patient feedback. And then hopefully this personalized approach ensures that patients receive the most effective care for their particular POTS needs.
Well, that's wonderful. Looking at how the body works and how it can misfire at times is important over here. Um, so Rad, what's your thoughts about this?
I was thinking I'm more intrigued with the COVID link. I'm going to learn more about this. There's somebody called Dr. Daniel Griffin who shares clinical updates weekly. If anybody wants to learn more about the connection of POTS, COVID, and long COVID, you can put Dr. Griffin on YouTube and see what they say. I'm going to go back to some other podcast and see what they have on this, because I'm personally pretty ignorant on the link between POTS and COVID. I have heard of the link, but I'm not sure what exactly the mechanism is, and also how strong the association is. So that's my personal point of curiosity after tonight's webinar.
Don't forget, COVID enters something called the AT2 receptor, so that lines all your blood vessels. So it's an integral part of that. And other viruses can cause this too as well. So one of the things is being healthy and exploring your health. And so this reminds me is that POTS is one process, and knowing your heart rate and blood pressure is really quite important as well. So I want to thank the team and realize that there's so much we still don't know and so much we do know. And thank you so much, everybody, and have a great night.